Hi Dhaval.
Hello, Birajji. This is Kayo. We've exchanged
Hi
a few,
Kayo. How are
we've
you?
exchanged
Yeah,
a
we
few
are all working
emails.
on
Yes,
emails. Now I can put a
paste to the names. Yes,
name.
definitely.
Absolutely.
Okay, Birajji, I will just admit everyone into the group.
Hello.
Okay.
Hi Dhaval. Dhaval,
Yeah,
we'll catch up after this, huh?
yeah, sure.
Just
Yeah.
just text and call. Don't fix a time. Just text and call. Yeah.
Yeah.
Okay, Sanjay, we can just start with the recording, etc. I'll admit everyone.
We are accepting registrations now, not till for December. है ना?
Okay, good afternoon, everyone. Thank you for joining this session. We'll just wait for a couple of minutes for some more folks to join the call. We have a good number of registrations, so expecting a lot of folks here. Till everyone is joining in, just a couple of hygiene rules requesting everyone to keep yourself on mute unless you have something to say. And it would be nice if everyone could turn on their videos, bandwidth, etc., permitting, so that we can have a more engaging conversation. We'll just wait for another 2 minutes, Biraji and Nilay, and then we can get started. Yeah. Okay, in the interest of time, I think we should get started. Just a request to everyone, if your bandwidth permits, please turn your videos on so that the facilitators of this conversation can look at some faces and have a more engaging conversation. It's always nice to look at faces instead of blank screens. It makes for a much more meaningful conversation. So, thank you everyone for joining. Good afternoon. I know it's an afternoon session, but thank you all for taking the time out. We're hoping to have an engaging 2 hour session. We have scheduled time for a presentation from the Flip team with question and answers to follow after that. So feel free to drop in your questions in the chat, and there is designated Q&A session towards the end. So please hold on to your questions and the team will help address all of those concerns towards the end. So I'll take this opportunity to welcome Biraji and the entire Flip team from NFI who are happy to host this session for you on Flip to walk you through how insurance, etc., would benefit you and your organization and your team. So over to you, Biraji, and thank you so much for taking the time for joining us.
Yeah. Thanks very much to Kayo, to Dhaval, and the entire Dana Mujo team for organizing this. I think this is very very important. मैं हिंदी और इंग्लिश मिक्स करके बोलूंगा ताकि सारे साथी समझ पाएं. तो पहले तो बहुत बहुत धन्यवाद आप लोग आए. तो मैं बस दो चार चीजें ही बताना चाहता हूं बिफोर वी गो इनटू द प्रेजेंटेशन. एक तो this is a health insurance product for the social sector. Oriental Insurance के साथ बात करने के बाद we have negotiated this for the sector. It works better for organizations uh, across the country because it's open to anyone across the country. ये हमने शुरू इसलिए किया दो रीजन से, और मेरे कोलीग्स यहाँ पे हैं, निलय और तुलसी, जो आपको डिटेल प्रेजेंटेशन देंगे, एंड समीरा हु इज आवर प्रोग्राम डायरेक्टर हु इज आल्सो गोइंग टू बी हियर टू एड्रेस योर क्वेश्चंस. तो ये हमने शुरू किया कोविड के बाद, बिकॉज व्हेन कोविड हैपेंड वी स्टार्टेड अ स्कीम वेयर वी वर गिविंग ex gratia money to the families of those who had passed away, and medical expenses of those who were who were hospitalized. और उस टाइम पे हमने रियलाइज किया कि बहुत तादाद में ओके, दिनेश से इंग्लिश में बोलिए, मिक्स, आई से बोथ इन इंग्लिश एंड हिंदी, दिनेश. बहुत तादाद में लोग हमारे सेक्टर के हेल्थ इंश्योरेंस से कवर्ड नहीं थे. वी डिस्कवर्ड that a large number of people in our sector were not covered with health insurance. And so we approached Oriental and we got the scheme through. Now, because we have very large numbers, potentially we can do 25, 30, 30, 40, 50,000 लोगों को हम cover कर सकते हैं. We have got very good premium rates which will come down further. This is the first year, this is a pilot, and the rates will decrease as the enrollment increases. NFI का इसमें कोई fiduciary interest नहीं है. NFI का कोई इसमें we are not a broker. The broker is a company called Secure Now. The insurer is a company called Oriental Insurance, which is a public sector health insurance company. The payments are made directly by the NGO to the insurer. तो हम NFI की तरफ से मैं ये कहना चाहता हूँ कि हमारा इसमें कोई फिनेंशियल वो स्टेक नहीं है. इंश्योरेंस कंपनी ओरिएंटल है, ब्रोकर सिक्योर नाउ है. NFI का रोल सिर्फ बैक एंड बनाना, स्कीम बनाना और सेक्टर को लिंक करने का है. We only maintain, we have done the back end, we maintain the back end, we certify the organizations who will join in, and then it is between the organization and the insurer in terms of the financial transaction. However, the broker, Secure Now, will ensure that in case a claim is not being processed or if there's a problem, then we step in. So Secure Now will ensure that they step in and they do the claims processing, because as you know, insurance is entirely about claims and denial of claims. So we have a set of people who are working. सब लोग म्यूट कर लें तो अच्छा रहेगा, if somebody is unmuted. Thanks नीरज. तो जैसे मैं कह रहा था कि जो इंश्योरेंस है वो इंश्योरेंस कंपनी दे रही है, ब्रोकर है, वो क्लेम्स प्रोसेसिंग में मदद करेगा. NFI का काम सिर्फ आपको जोड़ना है इंश्योरेंस कंपनी के साथ. बेसिक्स जो स्कीम्स की हैं वो हम आपको बता देंगे. 2-3 जो हमें फीडबैक मिले हैं वो भी मैं आपको बताना चाहता हूं कि क्या क्या लोगों को लग रहा है. एक तो कई छोटी संस्थाएं हैं जो अभी भी प्रीमियम अफोर्ड नहीं कर पा रही हैं. उनके लिए जो छोटी संस्थाएं हैं जिनका टोटल टर्नओवर 25 लाख से कम है, जैसे कोई संस्था है जिसका 10 लाख है, 15 लाख है साल का इनकम या एक्सपेंडिचर, उनके लिए NFI प्रीमियम भर देगा. So just to clarify that one feedback we got that even with these preferential rates, many small organizations cannot afford the insurance. Ravi ji, thoda mute kar lijiye. Thank you. Small organizations cannot afford the insurance premium. So for those organizations whose turnover is less than 25 lakhs, suppose it's 15 lakhs or 10 lakhs, and who are based in the northeastern part of India or in Maharashtra, Chhattisgarh, and Orissa, which are the priority states for, and Madhya Pradesh, Madhya Pradesh,